نستمع إلى دكتور جمال الطلحي عن Clinical Skills Lab Structure and Rule في أولى المحطات. دكتور جمال الطلحي خريج كلية الطب جامعة العرب الطبية حينها سنة 1988. MSc في Gastroenterology University of London سنة 92. MRCP Glasgow 2004. FRCP UK 2006. Consultant gastroenterologist, Dean of Faculty of Medicine, Libya International Medical University, teaching staff at the Faculty of Medicine, and consultant physician gastroenterologist at Ipswich Hospital, UK. Dr. Jamal, the floor is yours.
Shukran, Dr. Muhammad. I was really happy. You said 2004. It was 10 years later, so I feel a bit younger than I thought. It's nice start. Today I'm going to talk about Clinical Skills Lab, its role, why it is important, its place in the medical school curriculum. Clinical Skills Lab covers different gaps in the medical curriculum in terms of skills. As Professor Wajdi Talat mentioned earlier on, in the medical school we always talk about knowledge, skills and attitude. So I'm going to cover this part in the next few minutes. Just quickly go through what I'm going to cover by the end of this session. So I'm going to define the word skill and then Clinical Skills Lab as an entity and the reasons behind the necessity of having Clinical Skills Lab in medical schools and what is required to have a Clinical Skills Lab, and then discuss whether it's good or bad to have that part of the university used for that specific task. So, skills. What we always do in our day-to-day life is basically something like knowledge, some skills. Playing football is a skill. Driving a car is a skill. Performing a surgery is a skill. So they are all skills, but skills come from a background knowledge that we have. We apply that in that specific setting. Clinical skills is slightly different. It has something to do with patient care, with how we interact with patients, how we treat patients, how we talk to patients, how we examine patients. That is clinical skills. And there are different entities again. Talking about psychomotor, it's what's in the brain that moves to the body, to the arms, like performing a specific skill, like stitching, as an example. There is what we call communication skills. Communication skills is what we have in our minds. We pass it to someone else in a clear way, and a way that they understand well, so they don't get the wrong message. We apply this in our relationships with our colleagues, with our seniors, with our trainees, with our patients, in different settings. We use our verbal skills as well as what we call non-verbal skills. The way we move, the way we look, the way we move our arms, the way we use the tone of our voice. These are all part of the what we call communication skills. Other types, cognitive skills, we call it cognitive, I would call it cognitive skills, like decision making. Decision making, maybe, it is a skill, a kind of a skill. Again, it needs a lot of knowledge and background experience. So, do we need Clinical Skills Lab in our schools? I probably follow the footsteps of Prof. Wajdi here, trying to make it kind of interactive here. So, do we need a Clinical Skills Lab in our schools? Who agrees? Just hands up if possible. Who thinks that we do not need Clinical Skills Lab in our medical schools? So the majority have no decision on whether we need that or not, yeah? That's good. Okay, so let's put it in a different way. Do we think that our students graduate from our medical schools with the required skills or not? Raise your hands if you think they are equipped with the skills we need them to have at the point of graduation? Can you raise your hands if you think they have the skills? So, probably you all agree that they don't have the required skills. Any reasons? Can you say anything about why we think that our students, our graduates, don't have the necessary skills? Maybe our clinicians as well. So who thinks our clinicians now have the skills to perform their day-to-day tasks? Can you raise your hands again? Say, if our graduate, talk about experienced physicians and surgeons, do they have the necessary skills or they don't have that? Can you raise your hands if you think they do not have the skills? Required skills. The required skills for their profession. So raise your hand if you think they do not have the required skills. Okay. So yeah, so there's a problem. Any reasons? Can you just name some reasons? Why do we think that our graduates, sometimes our postgraduate students, sometimes the experienced physicians don't have the skills? There should be some reasons. Can you just, yeah? Structured training, okay, yeah? Yeah. Sorry?
Settings, appropriate settings.
Appropriate settings. For our medical schools, what we need is a student and a patient and a trainer. Is that right? So we have all that. We have our patients, we have the student, and we have the trainer. Who, let's say, put it this way, who I think can believe that they are experienced enough to teach. So where's the problem if we have that setting?
Maybe curriculum.
Curriculum? Yeah, possible.
The setting is not appropriate. I believe the hospital
Yeah.
still is not the appropriate.
Yeah. So there are gaps here. There are problems. Yeah, there are problems. Let's talk about possible scenarios. In the old age, talk about, let's say, 50, 60, 100 years ago, medical students used to get taught on skills on something like a professor doing that, or a doctor doing that. Students are around the body, if it's a cadaver or whatever, or a patient, and they teach them, right? Nowadays, there have been some changes. Technology, is it good or bad? Technology is good. Availability of radiology, availability of lab tests made the stay of the patients in hospitals much shorter. So the encounter between a patient and a student has become maybe a little bit shorter. Number two, the availability of services out of the walls of the hospitals. Talking about private clinics, private hospitals, primary healthcare settings. So less patients tend to go and get admitted in hospitals. So that does affect the time spent on teaching the students how to perform a specific skill on the patient. Let's take it a different way. The seniors who used to teach students are nowadays busy with admin work. Is that right? They're busy with private work, with admin, with research. Yeah. So that time has shortened a bit, and that meant there's a problem. But we are still doing it the same way. We still insist on sending these students to hospitals. You go there, you'll see patients. One of our problems in the faculty of medicine here in Limu, I'm sure faculty of medicine in Benghazi, is the fact that they come sometimes back and say, well, no patients. No patients in the wards. We can't put a theme for a week. We can't say this week we'll cover cardiovascular system. Because we don't have sometimes the patients that have the necessary normal or abnormal physical signs for the trainee to learn them. So there's a problem. So that led to the belief that there is a gap, there is a problem. And that's where other alternatives have kind of emerged to cover that shortage in training students. Let's talk about students here. And by the way, that also applies to postgraduates. Postgraduates don't get training. And I think we talked about, Arif said something about training. There's no training. Some bodies are there just to test and assess and examine or judge the trainees, but they don't provide training. It's not the will, it's the lack of everything there. So clinical skills lab have to come into place. So I'm going to quickly talk about clinical skills lab and define it. It's a simple place where students and sometimes qualified staff learn different skills: clinical skills, IT skills, communication skills. It doesn't matter what format of your strategy is, whether it's PPL, whether it's traditional, whether it's a hybrid system. There's always a place for clinical skills lab, because you know that you can get your students into the lab in a systematic, organized, structured system to fill the gaps that they have, that they cannot accomplish in hospital or primary healthcare settings. On top of that, clinical skills lab can adopt to different settings. It doesn't have to be a medical school. It can serve dental school. It can serve pharmacy. It can serve different entities. So there is a kind of flexibility. The word clinical skills lab is something that some faculties or universities, talk about general in our region, will take it as if this is going to be a big project that will drain the money, that will drain, it needs effort, yeah, it needs work. But it depends on what you want to do, what requirements are, what your objectives are. So I'm going to quickly, it can be nothing more than a space. Can be. Depends on what you want it from, what you want from that place to provide. So basically it can be just a space with maybe a mannequin or two, maybe some lines in terms of cannulation sets or drips or whatever, and you fill the gaps and we learn as we go. Maybe learn by doing, let's say it this way. But ideally, it can be built for purpose clinical skills facility. And that should be the aim. You have to have a clinical skills that fulfills your requirements to graduate your students with the skills that are required. So what you need is clinical skills lab, maybe for a start anywhere in your institute. It could be a hospital, could be a university, it could be a workplace sometimes in some areas, to train them in the basic skills they need to learn. So, but you have to equip it with different things. So every university has its requirements, but the basics are for medical schools. You have to have some mannequins that represent normal and abnormal problems, that represent changeable scenarios. So in other words, you may have a mannequin for a certain purpose. You can change that to do a different sort of scenario. You may need other complementary, not complementary, but necessary to say it, equipment along with that. Talking about you need DVDs for teaching purposes. So students should have their clinical skills sessions. They should sometimes go and watch what they've done, either recording their activities and they go back and watch them and give the feedback necessary that is important there, or maybe watch a standard procedure from the university or somewhere else to kind of correct and get the feedback and to improve their skills. So for students, there's a great benefit there. It's a safe environment. Taking the students and the traditional way of moving students from the, let's say, third year to hospitals, and then you go and walk in a room full with sick people that who cannot sometimes breathe or move, and you start teaching your students on an examination of a certain part that could be painful, distressed, uncomfortable to the patients, and sometimes we spend 2-3 hours there. That's not the best way to start. And that's why we adopted Limu here, what we call foundation course. That we, I call it sometimes with the students المعسكر بتاع التأسيسي تاع الجيش يعني. عندك 3 شهور, you have to master certain skills, and then you go out. So students gain that confidence because they practice their skills, supervised, they get the feedback they need, they are motivated to learn, they sit and talk, and they can repeat the skill. That is not available in hospital settings. In hospital settings, you may not get the chance to touch a patient in a full clinical session. Sometimes we have groups, or even sometimes of 10, 15. Maybe, if they are lucky, 2-3 students will touch that patient. The rest will just watch. So it's not a clinical. This is just another session of regurgitating the knowledge that they've already heard in a lecture or about to hear in a lecture. So they learn communication skills. We talk about how to communicate patients, breaking bad news. We talk about how to deal with distressed patients, angry patients, how to deal with, how to use your non-verbal skills, how to use silence as a language, how to use other skills like talking to blind people or blind patients or deaf patients. We do that in the Faculty of Medicine here. So that is done in a safe and closed environment. So that makes the students ready to go to the next step, seeing patients in hospitals, makes it easier. So, as I said, it can be anything from a single room to a complicated purpose-built facility. This is just a list of the educational resources, just a reminder again. This is what you need. You don't have to have all of that, but they are, in terms of their availability, most of them are easy to provide, easy to use. What you need is an organized, structured training program for students to fill the gaps. There's no point repeating what they're learning somewhere else. There's no point going through something they would never understand. There's no point going through something and then forget about it. So in terms of using the skills lab, I think this is vital. And sometimes not just filling the gaps, but as a complementary facility to the clinical training. So again, I don't want to go through that, so that's what you sometimes need in a clinical skills setting. This is just one of the pictures from our students. Areas are kind of divided into what looks like hospital setting, beds and mannequins in between, and students perform their skills according to their program that day. Again, bank of slides, lab reports, radiological images, ECGs, and we have the ECG machine, we have the ultrasound machine, we have the endoscopy training set, we have, it's all available there. So it's just organize and standardize your programs as the student goes on from first to the final year in medical school. Simulators are important, and we use that so often in the Faculty of Medicine and other faculties as well. I think it should also be ready for exams. Talking about workshops, OSCE exams. By the use, we use in the let's say foundation course, we use actors, we use simulators to assess students' performance. So advantages, just quickly, a skill center is a protected, clean, safe environment for students, and they had the opportunity to go back and redo the skill. They have opportunity to have or receive a feedback. And it's independent of the availability of patients. So we cannot say, if you are going to examine, let's say, perform lumbar puncture as an example, you cannot say, no patients are there to do that, so sorry, just come some other time. We have the mannequin and we can do it in that specific day. It's in the program, so there's no waste of time or resources. Sometimes there's a chance for students to pause, what you call pause between sessions. Just stop, regurg, think, come back again. They can watch a reference video. They can talk to their trainers and go back again. This is just a demonstration of some skills our students go through. These are fourth-year students learning about surgical instruments, doing or put ECG leads and doing ECG. Again, teachers can improve their skills as well, their teaching ability and their clinical skills. And they have to come to the skills lab ready to be an example, standardized example to their students. So for teachers, it's also of great benefit. So problems. So it's not all rosy and nice and smiley. There are problems. So what do you think? What are the problems of clinical skills lab? What do you think is not right or maybe a disadvantage in the clinical skills lab setting? Any idea? What's not right? What do you think may go wrong?
Dr. Jamal, I would be interested to know how you incorporate these skills in your curriculum.
Yeah, what we do, we have, let's talk about specific program here. Talk about the foundation. Foundation is divided into weeks. Every week covers a specific specialty. Let's say if it's gastro, let's say if it's cardiovascular system. So students will learn about ECGs, will learn about X-rays, and will learn about how to take a history from a cardiovascular system patient, and how to examine cardiovascular system. They watch videos. So all skills related to that specific system are covered in the same week. And then we have 2 days where students go back and do all that supervised by our tutors. So it's covered by the senior member of staff first, talk to them about that. They watch the videos, and they go back and they act. We have written scenarios for different medical history for each system, and we teach we show the actors what to do and how to answer and what to do exactly. Students go and take the history, and they have their assessment carried out the day. And then the same applies for clinical exam scenarios according to the checklist we have in the clinical skills lab. And then we have 1 day, and 2 days in fact, 1 day where students go back and do all that independently under the supervision of the tutors. Then we ask them to get in touch with a special, let's say specialists in the hospitals, to go back after hours to hospitals to practice that specific skill in hospitals. So that's what we do in that specific 3 months. Yeah. Just one more thing, disadvantages. Sometimes big number of students per group. If we have the same scenario in hospitals, that we have 15 students to learn a skill, that's not right. So we have to make sure that doesn't happen. Sometimes the clinical skills session becomes more of a theoretical thing. So just talk about the skill, not doing it. And that's not something we like to see. And sometimes it becomes a lengthy procedure, lengthy skill session that makes students tired and bored sometimes. Again, there could be a delay between as going back to your question, sometimes we talk about the examination of a chest, and then we don't do it in the skills lab until about maybe 3 months or 4 months later. That's not right. So timing the skill to the background knowledge, because skill is a knowledge that is applied in a skills way. So I don't want to, this is one more slide. Some schools devoted no enough time in the curriculum for skills teaching. So that's one of the problems, a specific curriculum for skills. So I think in a way all factors have to work together to make sure that the necessary skills are covered per each faculty. So I'll just summarize what I was talking about. So clinical skills acquisition is a major locus of education for health professionals in general. It does fill the gaps, as we said. It's important. Its role is important. Clinical skills centers can significantly contribute to medical education. The main objective of clinical skills is to help improve and maintain clinical skills and not to replace the bedside teaching. It's a complementary and supportive to that activity. Thank you very much.